Your body makes hormones called GLP-1 and GIP. Tirzepatide, or Zepbound, is a medication that pretends to be these hormones, so you feel fuller faster when you're eating. This will translate to eating less and feeling fuller longer after eating. These hormones work on the stomach to delay gastric emptying. Gastric emptying is the time that it takes for food to go from your stomach to your intestine, which will contribute to a feeling of fullness. Food will sit in your stomach longer before transitioning into your intestine. Therefore, it's important to eat slower and eat less when taking these medications to avoid any side effects like nausea or vomiting. The amount of weight you can expect to lose will be unique to each individual. This medication promotes about a 20% body weight loss from baseline. That means for someone who weighs 300 pounds, they can expect to lose about 60 pounds. For a patient who weighs 250 pounds, they can expect to lose about 50 pounds. It's important to know that it can take about a year and a half to see the maximum amount of weight loss expected. And it's important to remember that some people may lose more weight and some people may lose less weight than that on this medication. This medication is an injection and is taken 1 time per week. So if you were to do your injection on a Sunday, your next dose would be the following Sunday. There are 6 different doses of this medication. You take each dose at least for 4 weeks or 4 injections before stepping up to the next dose. The 5, 10, and 15 milligram doses are the long-term doses and the goal doses to get to. The dose escalation or step-up strategy is to start at 2.5 milligrams once per week for 4 weeks. Then, if good tolerability, you can step up to the 5 milligram dose once per week for 4 weeks. The next dose is 7.5 milligrams once per week for 4 weeks. Then 10 milligrams once per week for 4 weeks. Then 12.5 milligrams once per week for 4 weeks. And then finally, the maximum dose is 15 milligrams once per week thereafter. The most common side effects of tirzepatide or Zepbound are gastrointestinal, meaning that they affect the stomach. These are nausea, vomiting, diarrhea, constipation, or indigestion. If you experience any of these side effects, reach out to your weight management team. There are ways to minimize or prevent these side effects. Keep track of your progress. People who keep track of their progress tend to lose more weight than people who do not. Keep in mind that the average amount of weight loss seen is about 1 or 2 pounds per week. Keep a weight journal to keep track of this and share that with your weight management provider. The best time to weigh yourself at home is in the morning after you peed, before you had any food or beverage, with minimal or no clothing. Reach out to your weight management team if you've missed any doses. Depending on how long you've been off the medication, the dose you restart at may not be the same dose that you stopped taking. This medication is not considered safe during pregnancy. Use birth control or contraception if you are potentially able to get pregnant, and do not use if breastfeeding. Talk to your weight management provider related to family planning.
Now let's go over how to use your Zepbound pen. The Zepbound pen is a once weekly medication that can be taken any time of day with or without a meal. If you do take it on, let's say, a Sunday, you want to keep taking it on that same day of the week, so you keep taking it on a Sunday. The medication should be stored in the fridge. However, it can be left out at room temperature for up to 21 days. Because cold medication can be a little bit painful to inject, you can take your pen out about an hour or even a day before injecting the medication in order for it to come up to room temperature. When you're ready to take the medication, make sure you start off with a clean environment, wash your hands with soap and water, and wipe the area you're about to inject with an alcohol wipe. Wait for the alcohol wipe to dry before injecting the medication. The areas you can inject can be the abdominal area, upper arm, or thigh. Now that you're ready to inject the medication, you will remove the cap and set that to the side. You will see that there is a lock button at the top of the pen, which you will twist once you are ready to use the medication. You will place the pen at a 90-degree angle on the area you wish to inject and press down on the button. You will hear a click, and then you will hear the second click. That means the medication has been administered, but you would want to hold it in place for an extra 5 seconds and then remove the pen. If you do see any liquid coming out of the injection site, that could mean that you did not hold the pen in place for long enough, and you might not have received the full dose. So contact your weight management team to discuss that. Once you are done with the pen, you are able to throw the pen out into a sharps container or any household item with thick plastic, such as a laundry detergent bottle. You would then want to follow your local regulations on how best to dispose of these needles.